interactive talk, and I hope I can be of any help to anybody who's interested in ophthalmology. So,
you can just click on your computer.
Click on computer? Very good.
If not, you can just let me know.
So, up till now, this is the most updated condition of ophthalmology residency program. Across the country, we have a total of 125 residency program, and the size of the program usually is very small. Usually every class varies from 2 to 10 residents per year. Starting year 2023, there is a change of the policy. It used to be you can join a transitional year, any type, and then go into ophthalmology for 3 years of training. That's no longer true. So the PGY 1 year has to be an integrated or joint program to ophthalmology. In other words, they have more strict requirement for what type of transitional year that you can join in order to be qualified to join PGY 2 and as an ophthalmology resident. I will get more details later. So PGY 2 and 3, you are getting your ophthalmology training, and all these, every aspect of the running of the program, the training, are under strict regulations of ACGME. Okay, next. So these are the most updated data from our ACGME and SF Match website. As you know, compared to other subspecialties, ophthalmology don't join the major match website. We actually join SF Match. So our match day is in January, earlier than the general match. So this is the comparison. In the past 10 years, the positions available throughout the country has slightly increased from 461 positions in year 2014 to 516 positions in 2023. And it fairly high success rate of match every year, very minimal vacancies. So this past 2023 cycle, as you can see, for medical, for US medical school seniors, that is like they're in medical school year 4, they're applying right after their medical school. There are a total of 588 registered for ophthalmology match. And after the interviews and cycle interviews, there are finally 565 candidates that's actually registered, confirmed to join the match. Some dropped. So among them, 442 actually successfully matched. So the success rate for the US medical school senior graduates is about 78%. As compared to, you can see the bottom line, international applicants. So this year, there was 118 candidates that actually registered. That means they applied to the programs. But after interview cycles, only 59 candidates finally registered and participated in the match, and 17 successfully matched. The rate is about 29%. So this is also some clues. The average number of applications for a matched individual, usually you need to apply it to like around 80 programs. Unmatched individuals, not much difference statistically. And for a successful matched individual, usually they get around 10 interview invitations. And for unsuccessful individuals, it's way less. But this is a collective data. This may not run true for international graduates. For international graduates, your interview invitation would be very few, but that doesn't necessarily mean you won't get it. Okay, next. So once you get into ophthalmology residency, you first need to go to PGY 1 year, which now we call it an internship. It's either called joint, which is you go to a transitional program, not run by your ophthalmology program, or an integrated integrated program, which is actually run by your ophthalmology program. So the requirement is during that year, you have to do 3 months of ophthalmology clinical experience, no less, but no more, because they also require that the rest 9 months, you have to go through other subspecialties. So that year is also very, very important. And then in starting PGY 2, the settings is usually you go through general ophthalmology clinics and have a little taste of subspecialty clinics. PGY 3, you get a little bit more in-depth training involving clinical procedures, and you're starting to go to OR and get some experience as an assistant watching the surgeries. And in PGY 4, it is heavily surgery oriented. That's the senior residents usually spend most of the day in the OR doing cataract surgeries or glaucoma surgeries. So next one, please. So in the daily training, because ophthalmology usually don't have in-house patient, all of our service is outpatient. So our practice is a little bit different from family medicine, internal medicine, or general surgery. So our way of teaching is called practice under supervision. We don't have rounding. We always in the outpatient clinic setting see one patient at a time. So for example, if you see take a new general patient, a clinical encounter, our resident is supposed to do all these. They were supposed to greet the patient in the proper way, taking the history, not only the eye-related history, but also general medical history, family history, not much different from in the clinic setting of any other subspecialties, refraction, and check the ocular motility, slit lamp exam, applanation, check the eye pressure, dilate exam. And then these are all considered, the resident needs to carry all these tasks on their own. And at this point, they need to present to the attending physician, who is also always on site. Then the attending needs to do their own assessment for the patient. And then between them, they would discuss and then make the diagnosis and treatment plan, and then do charting. That's our usual way. What we call is practice under supervision. And for surgical training, it is very strict rules that how many cases a resident needs to do before they can get their certificate for graduation. So across this country, a resident has to do minimum 86 cataract surgeries as a primary surgeon in order for them to graduate. But this is the minimum requirement. The national average is every ophthalmology resident, when they graduate, the average number is like around 200 cataract cases. And you can see the list of all the other requirements that they have to do before they can be an board eligible ophthalmologist. Yes. So other than the clinical trainings, the residents also has to go didactics as any other subspecialties. So we do all the lecture series, and the resident needs to be involved in quality improvement projects, grant rounds, quality of care, or conferences. And across the country, we have a book series called the BCSC that the residents have to read through 3 times throughout their training, 1 year each cycle. And we have these question banks to help our residents to prepare for their board exams. Yes, please. And every year we have our OCAP exam, which is like to test medical knowledge. This is also to prepare them for future board exam. So, and all residents are required to plan and implement clinical research projects under the guidance of faculty members. So these are the photos to show our residents from our department. They went to national conferences to present their work. So this is just a brief summary of resident benefits and well-being. That residents' well-being has been a very important topic, a very important part of program director's job every day to make sure that the residents, even though they need to work hard, they're also being taken care of. So if you are doing your residency in New York area, then you have the union to protect you. You have to sign the contract upon when you sign the contract with the hospital, and they protect you from all the benefits. Every program has uploaded their salaries on the website, so there is no mystery. They have vacations, they have stipend to support their educational purpose, all their other benefits covered. So we always treat our residents very well with good food, good gathering. Okay, so I would like to change gears a little bit and talk about for international graduates. Even though ophthalmology is a very competitive world, and it's the chances for international graduates to be successfully matched to ophthalmology is not big, but it's not mission impossible. So what can we do to improve the success chance of being successfully matched? So number one is USMLE score. This is a must. So for every program for ophthalmology, if your score is not good, then your application profile won't even reach the selection committee. The secretary will directly delete it. So nowadays, USME just give pass and fail rate. So it's as long as you pass, everybody is the same. Then USM step 2 score, CK, is a very important importance. Our program, the unpublished guideline is anybody that below 240, that's not considerable. So and for international graduates, because it's so competitive, I would say 240 probably is not enough. So you would want to do something like 250 or even higher in order to get a chance for program to even look at your application. So good score, that's okay. But a good score is only the initial step. So to be honest, every application that come to ophthalmology, most of for all the, including all the US graduates, the scores are all pretty good. They're all like top tile students in their class. So go back.
This one?
Yep, that's me. Yeah. Okay, so as Dr. Khan has just mentioned, for a US medical school graduates, they have other criteria to judge if the resident is good or not. For example, the MSPE form, which is important, is used the old name of it is Dean's letter. In this letter, the medical school will give you all the explanations and describe how capable this candidate is compared to the class, and with the reputation of the medical school to endorse this candidate. So, but international graduates don't have that. Even though nowadays some Chinese medical schools are also mimicking that practice and give you similar letters of MSPE, but that's not comparable because most of the American programs, they have no idea what Chinese medical schools are. There is no endorsement. So we don't have that. So things that can help us is if we can go through clinical experience in the United States that really adds to or helping the program to understand how good you are. Talking about clinical experience, unlike other subspecialties, if you do like 1 month externalship or observationship in the doctor's office or in the hospital, that doesn't help because all the US medical students do that, and they usually get some kind of letter. It's nothing helping. But if you have already done your PGY 1 year in a program, and then the program directors or the doctors can give you good letters saying that in that year you are very qualified or very excellent resident already, that adds tremendously to your value. Because at that point, the program can evaluate you the same way as a US graduates. So you're almost on the same ground as a US graduates. So that helps. Actually, I know quite a few successful candidates that get into that ophthalmology residency in that route. It may take a couple more years, but that's a way that helps. Another obstacle is how you present your educational experience in the international setting. Because in US, we don't need to explain your education experience. Everybody understands. You go to high school, you go to college, and you go to medical school, and then everybody's the same pathway. But for example, if going from China, it's hard to explain to a US program director that first of all, we don't go to college. After high school, we directly go to medical school. And yes, you go to medical school, then you have a course of like 5 years versus 7 years versus 8 years before you graduate. And then you can be graduated with MS degree, PhD degree. This is really very confusing and very hard to convince people that your experience are true. And then there are another very excellent candidate I remembered one day came to us. He came from a big name Chinese eye institution, and he has spent 8 years there studying ophthalmology. And unfortunately, from anybody from background of China, we understand because he worked hard for the mentor. He spent most of his time writing papers and doing research for the mentor. So he's supposed then when we asked him after 8 years, how many cataract have you done? 0. How many pterygium surgery have you ever done? 0. Then it's very confusing. Here, after 3 years, we have to graduate with 200 cataract surgeries in order to be considered an ophthalmologist. And in China, you spend 8 years without any clinical experience. This is very confusing and misleading and not helping with the program, with the application. So when you present your clinical experience, you have to think very carefully how you explain all these differences to the program director or the selection committee and make them understand, even though you don't, that this is because the educational system difference between the countries, not because there's something red flagged by your personal competency. Research experiences. To be honest, it would be very odd nowadays if a candidate presented, whether it's international or US experience, you have 0 research experience. That would be very odd. And especially for international graduates, you usually started with like real research. So most of them have very long list of publications, very interesting projects being carried on, publications of very high SCI numbers. How much would those experiences help? In most of the cases, as long as you have research, that's it. It's 0 to 1. And does it add from 1 to 100? It doesn't. In ophthalmology residency training, we require residents to be involved in research, but our emphasis is on clinical training. So I met with some candidates who has a misunderstanding. Oh, this year I didn't match, so I'm gonna find a research place. I'm gonna do more research, and that way my profile will improve so that next year my chance will be higher? I usually say no. By adding more research papers, it probably won't add too much of your chance. You might as well spend that year going into a true clinical environment, and that will actually help. Immigration status, there's another misunderstanding. I hear there's some people always say, I have to apply for a green card before I can even apply for a US like residency. That's so not true. I know many residents who started with H1 or J1 visa. Yes, for a program to recruit someone that needs visa sponsorship, it's a little bit more paperwork. But any program that can sponsor research residency program, they have the capability of doing it. So if they don't choose that resident, it's not because of immigration status, it's other thoughts. If they really like a candidate, visa is not an issue. So I don't recommend that someone delay their process of applying or studying for boards or for USME or for residency application just because of consideration for immigration status. Okay, next. Okay, so starting COVID, our ophthalmology interview has all become virtual. And there are a lot of stories that happened for this virtual interview. So I would like to share some tips. All these tips, I'm sure medical school has taught their candidates. But for international graduates, nobody teach. So you guys should know. Number one, the location, that's very important. You have to make sure your internet connection is good, no disconnection, and there are minimal distraction. We had one time had an interview and then a cat came across the window. I mean, it's cute, but it's not professional. So eye contact with the camera, not the screen. So if you've done Zoom interview, you will notice, I didn't know this either before. I'll try to do it myself. So if you look at the screen, you think you were doing the eye contact. No, you're looking downward. So you have to look at the camera in order for the people to think that you were looking at them. That's important. Of course, you don't want to stare at them all the time. You need to make it natural, but think the camera as other people's face. And professional attire, needless to say, professional, right? But not only from waist up. Okay, so we've been, there are situations, okay, that you have to stand up. That would be not so good, not professional. And it always occurred to me that especially for Asian population, we're sometimes very shy, especially in situations like interview that's so important to us. And English is our second language. We tend to be shy and try to speak as little as possible. That's usually not a good sign. You wanted to show that you have passion, you like their program. So you want it to be energetic and enthusiastic, ask questions, but don't do it too much, okay? It has to be a well balance. You cannot be aggressive. So there's a very fine balance between enthusiastic and aggressive. I cannot say more. Everybody has to figure out their way. And if you have to take some notes or remember some long names, take your note from your eye level. You can look down sometimes, but that's already telling your interviewer that you are looking at something else. But if it's too much, then it's distracting. Okay, so yes, so these